So let's talk about spinal stenosis, what it is, how it's diagnosed, and the best ways to actually help treat it. Now, we have to look at what spinal stenosis actually is. It's actually broken down into two words. Spinal is actually addressing what happens in our back, but then stenosis is actually a word just telling us that there is a narrowing of a specific area. And here I have my nifty little spine model. And when it comes to talking about narrowing, there are a couple different places that we need to look at specifically. Number one is what we call the central canal, which is right here. Here we have our vertebral body in the backside. Right here is we have the central canal of where the spinal cord actually runs. And that is an opening. And because it's an opening, there is opportunities for that area to be narrowed, what we call stenosis. The other area that can also be affected would be the space between two vertebrae and this opening right here. We call this the foramen, aka another word for opening. And so when it comes to stenosis, we either have central canal stenosis, or we can have foraminal stenosis, or we can have both. And it really is dependent on what is happening, and it can be identified via MRIs, really more so because it helps us identify what the soft tissue is involved, especially when it comes to spinal discs. But when it comes to why it is getting irritated in the first place, we are looking at two major structures. The first major structure is actually going to be the spinal disc. Now, I've said this in previous videos, but one of the biggest things is that the disc contents will actually be the most malleable when we're younger, because as we're younger, we have a little bit more water content in the disc, and it starts to dry out as we age. And what that also means is the fact that when we are, say, bending forward, what ends up happening is that the contents of that disc actually moves in the direction of the least amount of pressure. So if we are leaning forward, if we're rounding forward a lot, that disc itself can bulge either straight out towards the side or straight back into this central canal, which, because of the way the model is, you won't be able to see it, but that you'll be able to identify via MRIs. So MRIs will actually help us spot, okay, where's this direction of the disc going? Also, we'll identify a couple of various different tears. But then the other area and the other structures that can actually be involved in spinal stenosis can actually be what we call bony overgrowth. Sometimes people would call it arthritis, where the area of where this nerve exits actually starts to become a little bit smaller. And that's what we call like bony overgrowth. We can call it foraminal stenosis. Now, in order for us to truly determine what is going to be the cause of the pain, we have to look at how do you present clinically, because the MRI will do its job to identify any fractures or tumors. But when it comes to identifying what the cause of the pain is, there's a lot of research saying that there isn't much correlation between the MRI and the cause of pain, which is why we have to take that information and also apply it clinically. Now, the really interesting thing is disc irritation and foraminal stenosis or central stenosis caused by disc herniations will present differently in the clinical standpoint than foraminal stenosis affecting the bones itself. And so what that means is that if your disc is actually truly the cause of pain, the way that we would identify it would be if the pain actually gets worse, usually with forward flexion, because as you can see, that disc will push out and it will relieve with what we call extension-based movements, which is going to be leaning back. Another way to look at it is that, say for example, this is the right side, this is the left side. If our bulge is coming out towards the right, leaning towards the side of pain will actually push the contents of the disc back in towards the middle. So disc stenosis will improve with usually extension of the low back, also leaning towards the side of the pain. Now, the opposite is true if you're actually dealing with foraminal stenosis caused by just a little bit of bony overgrowth of the openings right here. And what that means is that the bony overgrowth happens, the area in which this nerve can exit ends up getting a little bit smaller. And so the motions that actually will make the pain worse is if we make that hole even smaller. So if there's stenosis on the right side, any side bending is actually going to make that area more narrow, creating an opportunity for it to actually pinch. Again, this is on the clinical standpoint. What that also means that if we're doing a backwards bend, that area also does get a little bit smaller and has an opportunity to pinch, which means that the relieving movement should be the exact opposite, where we're actually leaning away. When we lean away, that opening gets wider, allows us to actually to have that nerve run more freely and less irritated. The other movement that can also be helpful is a forward bend, because a forward bend is going to be opening up this area right here. So it's going to be important for sure to use your MRIs to be able to identify, again, are there any tumors, fractures, or cancers? But in order for us to be able to say what is the cause of pain, how can you get relief, is actually identifying how you present clinically. So if you can identify that you are going to be, that your body prefers a different, a specific set of motions, it tells us a really good story. You should definitely communicate it either with your doctor, your physical therapist, or even just take note and have that guide how you move.